We usually think of the pharmacy aisle as this totally safe, foolproof zone, right? Well, welcome to this explainer for the Medicine Diary. Today, we're unpacking the vital, clinical truths behind the medicines you buy every single day. We're going to look at the incredibly powerful pharmacology hiding right there in plain sight on the drugstore shelf and break down the core medical facts that dictate exactly how these drugs interact with your body. So, can a simple trip to the drugstore actually be deadly? Picture this. A patient is fighting off a really nasty cold. They take a nighttime cold syrup and then follow it up a few hours later with a daytime cold powder, and finally, they pop a standard Tylenol just to help with a nagging headache. Well, without even realizing it, this person is unknowingly triple dosing on acetaminophen. They're literally creating a toxic buildup in their bloodstream and triggering an acute medical crisis. And this is incredibly common. The data shows that a massive 81% of adults in the US use over-the-counter medications as their first-line treatment for minor illnesses. And look, because these drugs are sitting right there on the shelf, totally accessible to anyone who walks in, there's this really dangerous widespread misconception that no prescription simply means it's 100% safe. But the stark reality, it's far more serious. The misuse of common everyday medicines is actually the leading cause of acute liver failure in the United States. Now, over-the-counter drugs absolutely do have low toxicity when they're used correctly, but make no mistake, they are still highly potent chemical compounds that absolutely demand our respect. Okay, let's dive into Section 1, decoding over-the-counter drugs and understanding the rules. So the FDA uses this acronym GROS. It stands for Generally Recognized as Safe and Effective. Basically, for a drug to even be allowed to be sold over the counter, the FDA has to determine that it has a very low potential for misuse and abuse. But more importantly, the safety margin has to be wide enough that you, the everyday consumer, can self-diagnose and self-treat safely without a doctor watching over your shoulder. And this brings us to a fascinating process called the Rx to OTC switch. What we're seeing is that heavy-hitting prescription drugs are increasingly making the jump straight to pharmacy shelves. I mean, we've got powerful medications like Narcan for opioid overdose reversals, O-pill for oral contraception, and Nexium 24HR for heartburn. The reality is, the medicines you can just walk in and buy today without a doctor's note are significantly more advanced and powerful than they were even a decade ago. Moving right along to Section 2, the big two painkillers. We're talking acetaminophen versus NSAIDs. If you're standing in the pain relief aisle, you're mostly looking at just these two major classes of medicine. Let's break down how they actually differ. Acetaminophen acts directly on the parts of your brain that control pain and body temperature, which makes it absolutely fantastic for fevers and headaches. But then we have NSAIDs, and this includes your ibuprofen, naproxen, and aspirin. NSAIDs take a completely different biological path. They physically block your body from making these hormone-like chemicals called prostaglandins. Because of that blocking action, NSAIDs are incredibly effective at reducing physical swelling and inflammation, say from a muscle sprain or a really sore throat. It's a vital distinction because acetaminophen notably does not treat inflammation at all. Let's get into Section 3, deadly mixes and mistakes, and the serious clinical risks of combination. So here is a highly dangerous interaction we need to talk about. Having 3 or more alcoholic drinks a day while taking acetaminophen is a rapid formula for severe liver damage and even potential organ failure. Think of your liver as your body's chemical processing plant, right? It has to break down both the alcohol and the drug using a very finite supply of enzymes. When you combine them, you completely overwhelm the organ's ability to filter out those toxins. The liver then basically panics and starts converting the acetaminophen into a highly toxic byproduct way faster than it can be cleared away, which literally damages the liver cells from the inside out. Meanwhile, overusing NSAIDs triggers its own rapid-fire list of dangers. Even in normal doses, prolonged use can really irritate your stomach lining, which can lead to severe stomach bleeding and digestive tract ulcers. If you push that dosage too high or take them for way too long, you risk kidney disease and kidney failure. Furthermore, NSAIDs can react really harmfully with certain prescription medications. Like, are you on blood thinners? If so, consulting a pharmacist before taking any NSAID is absolutely vital. And here is a critical warning for all the parents out there. Children and teens should never, ever be given aspirin unless explicitly directed by a healthcare provider. Giving aspirin to a child who's recovering from a viral infection like the flu or chickenpox can trigger a rare but potentially fatal condition known as Reye syndrome. This causes rapid, incredibly dangerous swelling in both the liver and the brain. Which brings us to Section 4, mastering the drug facts and learning how to read the label. To protect yourself and your family, you really have to become an expert at reading the back of the box. The FDA drug facts label is specifically designed for absolute clarity. Right there at the very top, it lists the exact active ingredients. Honestly, this is the single most important line of text on the whole box. It's your main key to preventing an accidental overdose. Mostly because so many completely different brands of cough, cold, and allergy medicines actually rely on the exact same active pharmaceutical ingredients. It's kind of like hunting for hidden sugars in your food. You really need to follow a few exact steps to ensure you're staying safe. First, always cross-check the active ingredients of every single medicine you're taking. Second, ensure you aren't accidentally double-dosing your child with two different branded syrups that happen to share that same active ingredient. Third, always use the specific dosing device provided in the package for children, never just a random kitchen spoon. And fourth, definitely check that expiration date, especially for babies and toddlers under 2 years old. Okay, our final section, Section 5, Smart Choices for Safe Relief. As the saying goes, most OTC medicines are safe to use, but they absolutely still carry a risk. When you respect the pharmacology behind these highly accessible medicines, you really empower yourself to find safe, effective relief. We hope this explainer has given you the tools you need to navigate the pharmacy aisle with real clinical confidence. Subscribe to the Medicine Diary for regular health and medicine awareness and share it with your loved ones. So after learning how powerful these everyday medications truly are, I want you to take a look at your own shelves tonight and ask yourself this one final question. What is really hiding in your medicine cabinet? And are you absolutely sure of what you're mixing? Stay safe, stay informed, and we will see you in the next explainer.